Good day, dear colleagues, friends, the potential students. My name is Boris Duberman. I am the head of the surgical department in State Medical University in Russia, and I am the head of the HPB Center of City Hospital number 1. It's one of the biggest hospital in Russian North, which deal with the most difficult, most interesting and most severe cases in cardiovascular, in thoracic, in HPB, in general surgery and urology and so on. So I would like to say very few words about our hospital. It's the oldest hospital in region. It is 230 years old, and it was organized as a multidisciplinary hospital. And for a moment there are more than 8 surgical departments, which include general surgery, gepatopancreatibiliary surgery, urology, cardiac surgery, vascular surgery, urology, and surgical and the department of surgical infection. All these departments are very specialized, and in our hospital there are more than 900 beds, which serve all patients with the most severe pathology in these fields. We are not only medical service, but we also the part of state medical university. I mean that on our basis there are 3 departments for medical education. It consists of Department of Surgery. On this department there are 5 professors, and moreover there are 10 associate professors and so on. So we are not only medical but also research and educational enterprise. Also on the base of our hospital there are Department of Therapeutical Department and Department of Urology. If we speak about our surgical department of medical university, so we are very big and we are very famous for our research work, of our medical work, and for a moment we have programs of postgraduate education in 6 specialty. These 6 specialty, they consist of surgery. The second is cardiovascular surgery, the third urology, the fourth endoscopy, the fifth thoracic surgery, and the sixth is interventional radiology. All these courses, all these programs, it has ownership, it has professional preparation, and all these programs, after the graduation from these courses, we can give a certificate which is official, and by this certificate you can continue your work in Russia, or you can continue your work in abroad. So we have in our department there are a lot of surgeons and a lot of researchers, a lot of people who take care of studying process, professors and associate professors and assistant, and we have a lot of foreign students too. So if you speak about our department, we also should say about that we have very long experience in education, and we can educate patients, educate students not only in Russian but also in English, and it's very important because all our courses they're English speaking, and from first course till the end, and on postgraduate education too. Also, I would like to say thank you very much for our wonderful helper, our wonderful student, our wonderful intern who graduated from our internship this year. It's Dipendra Kumar. He is very good. He is a very good professional. He is a good student and a very good man who can give you advice in our education.
Thank you, sir, for providing me such an excellent opportunity to interview. First of all, I want to know why any Indian or any foreign student should come. What is the reason behind it? Why should they come?
You see, it's an interesting question because we have a big amount of hospitals which can deal with education, but I mean for foreigners. But we are in the north, and we have the wonderful opportunity to take practical knowledge, to take theoretical knowledge, because we have a lot of patients, we have a very big hospital, they are very good equipped, and thanks to a lot of scientific, medical and other relations with Northern Norway, with London, with another foreign centers. We have many practitioners who can speak English, and they can give you the opportunity to speak in your own language.
My experience was pretty good here, in fact, right? Because I spent about 7 years here, right? So my experience is personally, if I can say, that was awesome. Especially some teachers was pretty good and they are try to explain me as much as possible, like you and Dennis Musgrove. They are pretty good with me always. But the student who didn't graduate from Russia, right? They want to come, and they just like because they don't have so much knowledge of the Russian, right? Because they're English-speaking people. So what do you think? Like, is any student who is English-speaking, right? He completed his education, basic education in India, and they can continue their post-graduation here. Is it possible?
I think it's very possible, because it's not a problem to receive any kind of education in all specialty which I have told about. And I think the problem is in Russia that all practical specialty, it is you have to work with patients, and it is only one problem which student can face with. But the problem with communication, with taking literature, with using internet.
In fact, what happened, if I personally feel like mostly of sometime what happened, if of course language was somehow it's hurdle, but personally if I say I have my friend who if I feel problem in the language, right, they always try to help me during the speaking to the patient also. So I never feel that problem. What do you think, like a lot of students want to go to different country of Europe, right? So why you think students would prefer this hospital or this country for compared to Europe? Why
there are several courses to come here. The first is good level of education. Yeah. The second is good quality of medical care. The third is very open mind and kind people who can help you, who can discuss with the problems which you will face with, and so on. And the fourth, I think, is the cheapest place to receive the education.
A lot of Indian students want to join cardiology or cardiovascular surgery here, or cardiothoracic surgery, right? So what do you want to recommend those students who want to join specialization in cardiovascular surgery here or cardiothoracic surgery?
Cardiovascular surgery is only one of the branches, only one of the fields of medicine, and in our region, in our hospital, there are open surgery, there are vascular surgery department, there is interventional radiology, 2 departments. So I think if the postgraduate student would like to receive knowledge, theory and practical skills, I think he will have many opportunities to receive it here.
And how's your experience with the international student? How they work here? How was they comfortable with working with you? How was that? How's your personal experience with them?
You see, the problem is that the relations and the attitude to the young surgeon, it's one of the main thing in the development of the person as a practitioner, and that's why the main thing is that the amount of students who are on postgraduate courses, they shouldn't be a lot of, there shouldn't be too much. And nowadays there are some changes in the law, and it became less and less Russian students, and that's why we need to have helpers, we need to have hands, and we would like to give our skills to newcomer, to new students, to foreigners, because from Russia it will become less and less, and that's why you have more and more opportunity to receive more and more knowledge and skills.
How's your experience with how is the student who come from it? They're okay or they are?
You see, there are very few students who come without motivation, without great will to be a surgeon, to be specialized surgeon, and that's why it's very easy to work with foreigners, because they have another mind, they have another approach to studying. They work by themselves much more time than Russian students, and it's very good. But the problem for us is only the legislation. There is no law for students, even postgraduate, even that they can make operations. It's a problem by themselves, and that's why we try to help them. And the main thing and the main way to success is the work one to one.
Right.
So it's the main thing. In this case, we can receive result and success. I would like to say that there are a lot of places to go, to abroad, to the Europe, to Germany, anywhere. But Russia is still very good, very skilled surgery school. So welcome to Russia. We are waiting for you, and we will try to make your studying, your learning here as successful as possible. Thank you very much.
Thank you so much.